All this is Dr. Mobeen Sayed from React 19 platform. Today we have a very important guest with us. We have Shaun Berkovich. Shaun was an early on vaccine adverse events victim, if I would, or a patient. Shaun has been talking about vaccine injury and the people who are going through this a lot. He himself is going through this as well. So today we wanted to sit down with Shaun, see his journey so far, years of it, and what has been working. So this discussion is more going to be practical for people who are struggling with long COVID and vaccine injury. So with this, Shaun, welcome.
Hi, Dr. Mobeen. Thanks for having me again. It's been quite some time since we connected, and I remember, when we decided to do this, I was reflecting back on those early days when we found each other and we did the first kind of Dr. Mobeen show where I talked about what I was experiencing and how traumatic it was back then. And boy, it's hard to believe that we're over 6 years and we're still at this, and here we are again. But it's a pleasure to be here. I'm looking forward to discussing with you where I've been, what I've been doing, and where I'm going.
Thank you very much. And I do remember times, I think at that time, and this should be true for anyone who either has long COVID or vaccine injury, that they become panicky to say, what happened to me? How would it go away? Can I do something to make it go away? And I remember your times as well when you were exploring and you were trying to figure it out. And yes, it is 6 years and here we are. So tell me, for the discussion today, what is the big topic that may be of help for people that they should stick around to listen to?
Well, I think it would be good for people to hear a little bit about what I've been doing in terms of treatments, how it's been helping me, the current status of all my symptoms. I think that's pretty key. And then I think maybe we should talk a little bit about the lay of the land, like some of the predominant theories that are out there circulating, some of the other treatments that are being offered, where's the research, what's needed still. I mean, the kind of taking stock of the situation, not only my own situation, but the situation of the COVID vaccine injured in general. So I think that's those are all important points, but I think the most important point is for people to know what I've been doing, because I've kind of been a bit AWOL, missing in action for a little bit online.
Understood. So thank you very much to be with me, and the cool beans. I see a number of people who are here. If you have any question while you're in live, then please just put a single Q before the question so I can look at the glance of comments. I wanted to give a disclaimer. I have been contracting with CDC and I've been working with CDC. So it is, I think, important to declare that the discussion that I'm doing, it has nothing to do with CDC. It is not sponsored by CDC, supported by CDC, or agreed on by CDC. These are my opinions, Shaun's opinion, and our private opinions and discussions, not to do with CDC. So with this, Shaun, looking at today, what is the intervention that has helped you at this time?
Well, let's go back a little bit before I jump into that, because I think the last time we talked was we were together with Michelle Zimmerman. You remember that group chat webinar we had with her, and I think that must have been maybe 2 years ago, I think.
Yes.
And at that time, I was still reeling with all the symptoms, and just for the viewers to remind the viewers what I was dealing with, I think it's very similar to the pattern most people are familiar with. It's the small fiber neuropathy, which manifests as burning, stinging, stabbing sensations, prickling, the muscle fasciculations, the tinnitus on the side I was vaccinated that is so severe and manifests as a high hissing sound, the POTS where I stand up and my heart rate would zoom, and my legs would turn purple, the cardiac arrhythmias, ranging from atrial fibrillation to PVCs to premature atrial contractions. So that whole range of symptoms was what I was dealing with. So just to recap that. And I think since that last discussion when we were all together, I was still coping with all of that. But I think at a certain point in time, I realized that I needed to take a step back from everything related to vaccine injury. So I really, as fast and as furious as I threw myself into the advocacy role early on, I did that in the same manner, withdrawing from it. And I think because I was in such a dark place at the time, manifesting all those symptoms, all the suffering, all the burden of the suffering of all the others that were reaching out to me, I had to take a step back. And I took a big step back, and that was very painful because I left and disconnected abruptly with a lot of people that I grew very close to, because the vaccine injured community becomes like a family. And I narrowed my world down. And I did that because I felt I was losing myself to this illness, and it was consuming me. And I was losing my identity. I was losing friends. I was losing family. I was very dark, and I was very depressed. And I needed to find a way back to some parts of myself before this happened to me. And so that's where I focused, one. And I'm not saying that because I think that the mental shift helped me in any way, but the mental shift helped me learn how to live with my situation.
Yeah.
And manage it better. So I think before I get into the medical treatments, I think it's really important to talk about the mental part of this that was essential for me.
And in my opinion, even that is part of the interventions, right? So it is also known when somebody has a stressful state of mind that would cause, and people can look it up because sometimes it is said that, hey, whenever you bring in psychological effects, it is kind of blaming the patient itself. But stressful state, either because of the injury or because of the way the world reacted to it by simply dismissing it or even attacking those who are injured, or knowing that, hey, I am not healthy anymore, or financial issues, or trying to figure out what to do next. There is a hormone release from pituitary called ACTH, adrenocorticotropic hormone. ACTH would go to suprarenal gland and cause cortisol release. Cortisol release would cause glucagon release, which would increase glucose levels, which would cause reactive oxygen species production and inflammation. At the same time, suprarenal glands would also produce epinephrine and norepinephrine, which would cause inflammatory effects and hypertensive effects in the body, and create a flight and fright reaction. So there is a continued state of stress would actually do more damage to the pathology itself. So thank you for sharing that mental state management is very important too.
Right. And I think it's important. And don't get me wrong, I don't want to mislead anyone. Like, I'm not saying that helped my neuropathy or that helped my tinnitus. What that did was allow me to regain the mental fortitude to get back in the fight for my own health and try to get some sense of my life back and try to find some joy wherever I could in the darkness, because otherwise I would have downward spiraled and let it totally consume me. Because not only are you dealing with the suffering, you're dealing with the censorship, the abandonment from the government and from the medical community, the gaslighting, the medical debt, the desperation for treatment, it's all of that plus the suffering. And so for me, I had to regroup myself, and I didn't read any book. I didn't seek any counseling from anyone. I think as a medical person who dealt with people who had devastating illnesses, I knew what I had to do mentally. I had to not let the illness, which is becoming chronic, consume me. And so while I can have a chronic illness, I don't have to live a completely chronic illness life.
Very true. And just a brief comment. I'm not a diabetic person yet, but I wear this continuous glucose monitor just to see what causes inflammation and what does not. And by inflammation, increased glucose levels, which would then translate into inflammation, at least at my age. And I can tell you, anytime I'm busy in work, or that means it's not stressful, it is just work, or I'm actually stressful, in all those conditions, without having eaten any carbohydrates, my glucose levels go up, which is an indicator of cortisol levels increasing, producing glucagon, creating insulin resistance, and producing higher glucose levels. Body is thinking that it is actually helping you by increasing the glucose for your brain and muscles, but that glucose is going to now get used up and either stay outside the body cells and cause advanced glycation end products or age and non-enzymatic glycation and damage, or it would get into the cell and produce reactive oxygen species, which would cause inflammation. So there is biological mechanisms behind this, and anytime my stress levels go down, my glucose levels come down as well. So anyways, so that is that part. So
I would just want to add one thing, and what really helped me with, and I'm going to get to medical part of all of this and what I've been doing treatment wise too, but I think this is a very critical part, because I do know a lot of injured people out there that are suffering, and they're huddled at home and they're living in fear and they're full of anxiety and desperation, and I understand it because I lived it. But in this fight, I had a very close friend from Canada who was also almost identically injured to me, who never stopped working through the illness, and we would speak almost daily. And I watched as she evolved and got back out into the world, because at that time we were both living in total fear. We were in fear of our health, fear of our lives, fear of COVID. We didn't want to get COVID. We didn't know if COVID would make us worse. And then I watched her get so fed up with all the fear and go out and start living her life the best she could. Right? I'm not saying we're living full lives, but the best she could. And that kind of inspired me. And I was like, I have to do that. I have to get out. I have to start meeting people. I have to connect with humans. I have to live my life. I can't live in fear of COVID. Yes, I'm suffering. Yes, I'm stinging. Yes, my ear is ringing. But I've got to find a way to live, because there was no other. I didn't want to see the alternative, which was not to live anymore. So that was a key part of all of this. And I think the injured really need that kind of message of inspiration and hope, of not giving up and constantly just trying to find a way to live around this or through it.
Thank you very much. This is a very, very important message. So once you isolated yourself, you started working on yourself, started living your life. What happened next? Did you continue in that? Were you doing any interventions? You were not doing interventions. What was your medical
So if we
process?
look back at my history, as we know from our prior discussions, I did IVIG very early on. Right, I was very lucky because I work in medicine. I knew how to push the system and fight within the system. And with the help of NIH and my neurologist at Mount Sinai in New York, I was able to get a trial of IVIG back and this was in the early days when we were first having our meetings. And I wrote that case study, if you remember, about autoantibodies. It was loosely based on some theories that are yet unproven, but it was a way to help me secure some treatments. So I did that IVIG early on with steroids, and I really believe in my case that helped change the game in terms of the neuropathy and the POTS, the dysautonomia. It was a big game changer for me at that time. So when I did those series of treatments, my neuropathies would sometimes go into full remission, where I would be neuropathy free. And the downside, though, at that time when I did IVIG, is that it would affect my ear, my inner ear, and make my tinnitus worse. And then that would cause me to have to stop it. So that was one thing that I believe is very helpful in my case. I did go off it I'd have periods where I'm on it. I go periods where I'm off it. We see how it goes. When I'm off it for too long, my symptoms slowly creep back, sadly. So this past year, I was off IVIG for almost a whole year. But the last 4 months of that period, I started back with the neuropathy, the nerve pains through the tissues of my feet and my hands, the weakness, the fasciculations. It all just slowly comes back. So I went back on IVIG 2 months ago, and already my symptoms are improving.
That is amazing. And for the audience, Shaun and I were talking about IVIG, I think it's many years ago when you started having it. And I remember you'll have flare-ups after IVIG and you'll be in a bad shape at that time. For one more mechanistic comment, IVIGs are supposed to clear out, at least theoretically, the antibodies that may be present in our body which may be harmful. And other people may have counter antibodies, and so they help clear out the antibodies. And this is why it is not necessary that IVIG actually cures, more than it would clean out a bunch of antibodies that are built up in our body and then give the body a chance to either stay healthy or slowly build up new set of antibodies. And it could take, depending upon the of how fast the B cells are working, how much is the inflammatory state, within a few months to, as Shaun said, even 7-8 months. So IVIG is a very interesting solution. At least it would help control the symptoms. My question to you is, have you had other folks who are using IVIG, and do everyone benefit from it or not?
No, so that's the important point of all of this, is that, and I think it's sort of the fatal trap that the vaccine injured fall into, because I can come on here and I can talk about my case and what has helped me, and then somebody sitting at home, especially like a non-medical person who doesn't understand the complexities of medicine, will hear what I'm saying and they'll identify with some of my symptoms, maybe not all of my symptoms, and they'll think vaccine injury is a one size fits all. And unfortunately, it's not. And what works for one person isn't a grand slam for another person. But I do believe that when I hear about people traveling to Europe or to Japan and selling their house or having to do GoFundMes to get these treatments, I'm like, we have things available here that have helped some people here. And we need people to advocate for a right to try those things here. And I don't understand for 6 years why all the people who are so vocal about caring about us and helping us are not fighting for the right for plasmapheresis, fighting for the right for IVIG, fighting for the right to try immune modulating drugs like high-dose IV steroids or other immune modulators. They're all here. I don't understand why there's no one advocating the government for a research study to try them or compassionate use so people can try that. IVIG is a well-known immune modulating drug that helps a lot of immune-mediated illnesses. And I know it's expensive, but hell, we did what we were asked to do, right, by the government. We deserve some compassion and a right to try. And I think that's the most frustrating thing, because people will ask me, and sometimes I have guilt. I don't know if, it's almost like survivor's guilt. I feel guilty because I get access to things, and then I hear stories and people I can't get access, and that makes me feel very bad and guilty that I get it and someone else doesn't. But I think we need to have that right to try the options here, and people fighting for us to have that.
Absolutely correctly said. And this is also important from a mechanistic point of view. And again, I'm a mechanism guy. I'll keep inserting mechanisms. If IVIG is too, it causes too much adverse reaction in people, what that means is that we are taking antibodies from the community, and those antibodies, when they enter our body, they maybe are cross-reacting or they are attacking our tissues, and that is why some people actually feel worse. In such cases, plasmapheresis can be tried, because plasmapheresis would also clear out the antibodies without actually adding anything to the body. So plasmapheresis is also clearing out antibodies. IVIG is also clearing out antibodies. The benefit of IVIG is not only you clear out the antibodies that are bad in your body, but you get some healthy antibodies too that may help in other ways. So, and same thing can be the con of it, that there may be antibodies that would attack your body. So these two should be tried. And Shaun, you're very correct that we should have these two available, at least these two available, at least for testing to all patients.
Right, and plasmapheresis can be made. It's the problem in the U.S. is plasmapheresis was always seen as a very kind of last resort treatment. It's not very widely available across America. I was fortunate to be in New York at a hospital that has a very robust apheresis unit. And they're very, very advanced about trying it in all kinds of neurological cases. But my current protocol is so every month I go, when I'm not doing IVIG, every month I do plasmapheresis, right? And
how does that differentiate from IVIG for you?
Plasmapheresis. So the theory is I go in, I do a one-time exchange, they do a total plasmapheresis. They'll take out most of the circulating plasma, dump it. They'll give me human globulin, which is blanks, so plasma without all the antibodies and inflammatory markers, and then the same day I'll go and I'll get an infusion of IVIG, and then I'll have it split out over 3 days, the dosing, to give my body a break so I'm not getting a big, heavy dose at one time, which can give people more side effects. So it's like cleaning out and then replacing with a big pool to suppress. Because the thing is, what people don't understand is you can't just do plasmapheresis and go home. Plasmapheresis can often trigger a rebound effect, which I've experienced myself when I didn't do any IVIG. If I just go in and I do an exchange, they take everything out. Usually in 24, 48 to 72 hours, I'll get an eruption of crazy symptoms of because the body is like, whoa, there's nothing circulating, and it'll just dump out from your tissues whatever's in store, and it just causes like a dysregulation. So usually if you're just doing plasmapheresis, you should really couple it with like an immunosuppressant.
Very interesting.
That.
So there is a flare-up individually possible with both, but when you combine it, plasmapheresis clears out the antibodies, the body reacts and says, okay, I'm going to make a bunch of antibodies, and now you have IVIG to clear those out, and that is how you balance out the system.
Yeah.
That is very interesting. Before we continue, I have a few comments from the audience here. Number one, John said, I'm glad you mentioned that challenge because IVIG isn't an option for everyone. So that's what we discussed. So then Donna says the same thing, that some people respond poorly to IVIG. Brandy said, I've been trying to get IVIG for my daughter for 3 years. Insurance denied. This really bothers me when people are experiencing this. Anne says, many are fighting for those treatments but are getting nowhere. This is a kind comment from Anne. It's true, many cannot get access. Please don't feel guilty. So
the thing is, we need the people. I think so I was talking about what I'm currently doing to keep myself functional. But I think that there was also a time where I did high dose steroids as well to fully suppress the immune system. But that I was unable to sustain because of the cardiac arrhythmias. Steroids really would ramp up the arrhythmias. And I'm also taking an interleukin-1 receptor inhibitor called anakinra or Kineret. And that was a way to get me off of steroids for my hearing, because I also developed an autoimmune inner ear disease, and had hearing loss with the really severe tinnitus. So in order to get me off the steroids, there was a small trial for Kineret done, and that showed some promise. And so I was able to get that, and it's a daily injection in my abdomen. So I'm doing that. And then I think, the others are just the other range of immune modulators that we know of that people have tried, like, B cell suppressors like Cellcept or Imuran or Rituxan. I have tried in the past Imuran with plasmapheresis early on, but back then I was always cautious about staying on those for too long because even with anakinra, there's a small increased risk of cancer. So nothing comes without risk in treatments, right? As we know,
Of course.
you know, but if the benefits seem to outweigh the risks, you're willing to take that risk, then you do it.
Yeah. So John says, why interleukin 1 specifically? Is it interleukin 1 inhibitor or interleukin 1?
Interleukin 1 is a receptor inhibitor.
Yeah. Yeah. So interleukin 1 is one of the trigger for inflammatory state. Does it help, or is it a combination of plasmapheresis, IVIG, interleukin 1 and others, or by itself it helps too?
I think it definitely helps for stabilizing my hearing and keeping me off of steroids for sure.
Understood. And how about low dose naltrexone?
That I took early on for probably a year back in 2021 into 2022. I never found any benefit from it.
Understood. And Candy says, does MTHFR C677T affect how we heal? So
that's a Dr. Bean question.
So Candy, thank you very much. So this is one part of the research as well, that some people have MTHFR genetic change. And I think that we do not have any focused treatment options other than whatever patients are trying. And this is where Shaun's point, that there needs to be help for patients, and patients having to figure out by themselves.
Mm-hmm. I would just add on that point. I mean, I think I did test MTHFR. I did the testing and everything. I wasn't. I think I was heterozygous. I didn't have all the mutations or whatever that most people would have. One could say, oh, because of that, the vaccine triggered all of this. Like, that wasn't clear in my case. But I think if we look logically at, or what could have happened, is we know that the mRNA, at least the vaccines that many of us received, are they have a high reactogenicity. That means they really ramp up our immune system to like such a high level that even people who didn't develop syndromes, they had crazy side effects, right?
I will talk a little bit about the mechanistic areas that we are talking about. And I was discussing this with one of the patients a few days ago, so I think it may be relevant. There is a basic problem, and that is the pathology of the vaccine injury. And there are so many studies that are slowly now coming out to say what the injury may be. One of the injuries I want to share with you is by Dr. Bill Murphy. So let me bring it up and hope you can see this. So this is a paper, and look at the date on it. This paper is 2021. A possible role for anti-idiotype antibodies in SARS-CoV-2 infection and vaccination. This is such an old study, and it is still such a relevant study. What this study says, I'm going to use the diagram, and again, this is their copyright, but I hope they're okay with the teaching. What happens is, imagine that we have spike protein, regardless of what brought the spike protein in our body. What our body does is it produces a response to that. It produces antibodies that will bind with the spike protein. So let me see if I can actually increase the size of it. Probably. Okay, so here. So what we do is we produce a response to that. And so in this diagram, this AB1 or antibody 1 is the antibody that is produced, which is supposed to bind with the spike protein. So now we have memory B cells that are making these spike proteins, and our body is kind of happy that, hey, there was an invader and I have made a responding agent. These B cells would be in the local lymph nodes. Some of them will circulate in the blood, and some of them will end up in memory in bone marrow and live there for up to 3 years to forever. And if they don't live forever, then the patient would start feeling better within 2-3 years because these memory B cells would die away. But in some patients, they will not die away, or they would just continue to go on. So what happens is our body thinks that, okay, we need to do something about extra antibodies. So when the antibody 1 are produced, body doesn't know how much antibody 2 produce. So imagine that there are 1 million spike proteins that are introduced, and body in response produces 10 million antibodies. So now those extra 9 million antibodies are going to be running around in the body and cause inflammatory states. So body does something interesting. It produces, if you look on the right side here in the diagram where it says AB1, AB2, it produces another antibody which is titled here or tagged here as AB2. This antibody's job is to wipe out or clear out antibody 1, like a little mop. Just like when you get IVIG, whose job is to wipe out some of the antibodies. Here, the body produces its own little IVIG, which is called AB2, whose job is to bind with AB1 and clear it out. So I have a question for you now. What do you think the structure of antibody 2 should be if it wants to bind with antibody 1? So if I go down here, antibody 1 binds with spike protein. If our body has to make a protein that would bind with antibody 1, then of course you can imagine that that protein has to look like spike protein. So here we have antibody 2 which binds with AB1, and its structure is that of the spike protein binding region. And then what happens is that antibody 2 acts as our own spike protein. We don't have to sit down and say, where is the viral reservoir which is producing continuously the spike protein? Instead, we actually know that there is antibody 2 being produced, which looks like spike protein and is connecting with ACE2 and other areas where spike protein can bind and cause inflammation. This antibody 2 is the one that is called anti-idiotype antibody, and this is the one that can cause a lot of damage as well. And because it is being produced by B cells, it can be sitting in our bone marrow, these B cells, and producing this for a long time. And that is one of the effects. I mean, there are so many other possible pathologies, but this is one of the possible effects. And I'm going to go and see if Shaun is here. Welcome back, Shaun. I was doing a song and dance. I actually presented Dr. Bill Murphy's paper, which I think is the foundation for many of these autoimmune-like diseases. And Shaun, while you are here, I just wanted to add one more comment here. You would also notice that some vaccine-injured patients or long COVID patients, after 2, 3, 4 years, they start developing MCAS-like syndrome, or they start developing skin itching and rashes, and they start developing mast cell, dysregulation. It is not just that I'm seeing some doctors saying that, hey, you always had it, it just has become flared up. Maybe that is the case for some, but it is also possible that because of these continuously producing antibodies, these antibodies will go and settle on mast cell, which is their function. Antibodies do class switching, go to IgE, and IgE sits down on mast cell. So if I am a mast cell sitting down somewhere in a person's body and being idling, doing nothing, and then slowly antibodies are coming and attacking and attaching on me, this is called priming of the mast cell, then in a few years there will be enough mast cell primed that they would start degranulating with one reason or another. They are very unstable cells, and that is how the patient would start developing allergic problems. So back here to Shaun. So Shaun, we left off at interleukin 1, and I was going to ask, I had asked about low dose naltrexone. So interleukin-1 has been for your ears. Low-dose naltrexone, you said you tried it early on. Have you tried it more recently?
No, I haven't. No, but I do a stack of antihistamines and mast cell mediators just to try to tamp down the side effects of the IVIG. So when I received my IVIG, I asked my neurology team to add 1 gram of mag sulfate before, to tamp down the nervous system and the vascular system to prevent the headaches component. And that has been very effective and made it much more tolerable. I take Ketotifen, I take Singulair, which is a mast cell mediator, leukotriene, and I take Allegra, Pepcid, and Tylenol and Benadryl.
And once again, even to this commentary for Shaun, that he is taking a lot of mast cell stabilizers and anti-allergy, antihistamine type of drugs, it is not necessary that everyone was allergic forever and now somehow it just showed up now. It is also possible, as I said before, that antibodies are priming the mast cells over a few years, then the mast cells are coated enough that now they are unstable and they are just degranulating and causing all of these issues. I have a question for you, Shaun, which I am curious about. You had if you are open to discussing it, you had a number of heart-related issues and then interventions. How are you doing in that area?
So, if you recall early on, very beginning of my vaccine injury, I had palpitations very strong within days of the vaccine, and the autonomics were going crazy. Somebody asked about the insomnia. I had the crazy insomnia where I wasn't sleeping at all. I could physically not sleep, so I would jolt awake every 10 minutes through the night. But those palpitations and all that, the insomnia, it was all autonomic kind of based in autonomic dysfunction. I'd also have the temperature dysregulation. But then the cardiac stuff just kept evolving. So it went from like rapid heartbeats and pounding in my chest to PVCs that were picked up like in as early, I think I had the vaccine dose 1 in December, end of December of 2020, the second dose 3 weeks later, January of 2021. But by June, July, like I was already having skipped beats. I just didn't know it until one time it was picked up on a random EKG. And then by October of 2021, I was getting more rapid atrial contractions. So it evolved into AFib. I had the ablation for the AFib in April of 2023. And then I was okay for a while. I was still getting PVCs, but then I went off the IVIG and all the treatments. And by I would say, I think it was August or April of 2025, I started to get a high burden of PVCs again. So my heart just kept going crazy. Again, no one could explain why. The cardiologists are like, like you go to a electrophysiology cardiologist and he's just like, oh, well, we treat the arrhythmias. They don't really tell you why it's happening, or, they'll try to rule out myocarditis or pericarditis or whatnot. But he's like, I don't know what's causing it, but we can treat it with an ablation. So I went back in, I had another ablation a year ago. And the interesting thing about that ablation is within 3 days of coming home, I exploded with like all kinds of inflammatory. I had diverticulitis. It really sparked the deterioration of all my other symptoms. The nerve pain started coming back. And then, like 4 or 5 months of dealing with that, it was getting to the point where when I wake up in the morning, I had so much nerve pains and tissue pains through my feet and my arms. I could barely walk to the bathroom. It was like just so painful to move. And that's what prompted me to contact my neurological team and say, hey, I think I need to go back on treatment to put this back into remission. But why I'm saying all that is I think whenever you have an assault on your body, like a procedure, like an ablation, where they're burning tissue in your heart, you're stimulating inflammation and you're ramping up your body. And my neuro team, one of them told me, he's like, anytime you do that, it's very common for you to have this regressions. Even my neurosurgeon, who knew from day one about the vaccine injuries, he said, he wanted to do I'm eligible for another surgery on my back, but he's like, I really don't want you to have it until the last minute, because he's like, anytime I operate on people that I've seen who have your type of sequelae from the vaccine, it makes their symptoms worse. Their healing times are worse. So he's like, let's try to delay that till the last possible time.
Understood.
Very interesting, that any inflammatory or even getting sick, like with a virus, like one year I had flu A and my symptoms got a little worse. But yes,
Understood.
back to your original question, the cardiac situation persists. I had another ablation. I still have a little bit of skipped beats from time to time, but it's tolerable. I can live around it.
Understood. Good to know. So I have a number of questions that had been accumulating here while we were both figuring out our internets. So I'm going to go through them one by one. So Erica had asked about insomnia. I hope you have answered that in multiple answers. But just to see it, this was her question. Then there is a question from Bill. Bill says, are you using a biometric sensor band to monitor symptoms?
This is part of a research study, and my Apple Watch is connected to another, but these are both mostly related to long COVID studies.
Understood.
A whole other irony there. That's a whole other webinar. How the vaccine injured are studied under
doing long COVID,
polluting long COVID data.
Yeah, this is
the
horrible.
Absurdity of science.
Yeah. It's not science, right? It's the decision making. So Brandy says, do you know your COVID antibody levels?
So I don't put anything into that. I think that, and Dr. Bean can chime in, but, I work in medicine. I have to look at antibody levels for all kinds of things in all my patients. And I don't think that your antibody levels will wax and wane. They can be different. If I drew your antibody level today and I drew it tomorrow, you're not going to get the same result. So anybody who tries to convince you that getting certain numbers of your antibody levels means that you have spike protein circulating, I think that's a bit misleading. And I don't think it means anything. I think your titers, or we call them, or your antibody levels, can persist for a long time. And don't forget, in your day-to-day life, if you're out there living in the world, you're also probably getting natural exposure to spike protein. So your levels will fluctuate, and you might have asymptomatic infections. And those antibody level tests aren't specific to vaccine or viral. They're rolled up into one value. Yeah. But you can say more on that.
Yeah. And so Brandy, if you like, you can connect with me separately as well about this. And this is correct. And this is why I share Dr. Bill Murphy's paper. I am surprised. I'm surprised that we have not paid attention to that paper. Do you know that when this paper came out, Dr. Bill Murphy, Shaun asked me, is this the doc who likes the stacks of research papers? Yes. So I actually called him and said, could I come and shake your hands? And he said, what for? And I said, your study is a very important study for long COVID and vaccine injury patients. And he allowed me to come over. I drove 3 hours. I bought him a lunch. I sat down with him and we discussed. He was head of a BSL-3 lab for cancer immunology. Then I requested him to join me a few times. So you may have seen some of his lectures on my my channel as well. The antibody production can continue, looking like as if there is fresh spike protein present. But those antibodies are being produced by the memory B cells that may be living in the lymph nodes or the blood circulation or the memory or the bone marrow area. And that is the problem. How do we handle those cells instead of where do we go and find spike proteins? And I think it is kind of a sad situation that we have put the whole community looking for spike protein and virus reservoirs while there are memory B cells. Yes, there are studies that show that in some vaccine recipients, the spike protein production continues for months where it should not have been. So that is also true. Continuing with the questions, there's a question here by Brad. Has anyone used Bruce Patterson's test or treatments? So this doesn't look like a direct question to you, but there is a question to the community.
I used his cytokine test, but I have a whole tirade on cytokine testing and their utility. Again, like cytokine tests are so prone to error and inaccuracy. So with cytokines, they fluctuate, right? And just like the immune system, the cytokine system, they're dynamic processes in our body. So any given day, whatever is happening can affect the test. And when back in the early days when there was all this cytokine storm theories and everybody was doing the Patterson tests, we collated all those tests and we could never really identify patterns. Some people had high IL whatever, the other person had low IL-10, high IL-2, I don't know. They were all over the place. And then we took those tests, and I sent blood on one day to Patterson, and on the same day to LabCorp, I got results back, and they were both different, right? And then cytokine also, if you know anything about running laboratories, if you don't draw those tests properly, they're not properly handled, they're not properly transported to the lab, if they're not under the proper temperature control, they can affect and degrade the samples. So what do you do with that, right? And I think this is the problem, the fundamental problem of what is wrong with the vaccine injury treatment community is that we have a handful of people out there. There's research on cytokines, there's research on microclots, there's research on spike persistence, there's research on autoantibody, but there isn't enough, right? And so people just are trying to navigate this sea, and some of it is robust research, some of it is like speculative, right? It's a lot of it, most of it is unproven. And then we're trapped in this whole world of, like some clinicians, test everything until you find something.
Yeah.
But in reality, like somebody asked in your group, what are the autoantibodies related to CIDP? Well, that's very telling because there isn't really one autoantibody that means you have CIDP. And there's many we don't even know, right? There's a cluster we think can, in rare cases, cause CIDP, but there's so much unknown about the immune system still that we might not know. But we're left in this world of test everything and then treat what you find, right? And I think the classic one is like iliac vein compression. That was like, I feel like there's these trends in vaccine injury medicine. Like all of a sudden everybody's getting ultrasounds and getting stents in their iliac veins. And then when you look at the literature, in some of the literature, up to 60% of the public could have some degree of iliac vein compression. It doesn't mean that that's what's triggering your POTS or whatever, So we have to be very careful.
Yeah. I almost think that, and this is me just being theoretical, that we need to ask everyone to stop testing all these things. And now let's look at your actual pathology or possible pathology and then see what would help. There is one good news. Our vaccine and long COVID protocols on React 19 platform are about to be launched. My team and I worked on it for 1.5 years. So it's not here is a off the cuff, you should do this. So there is a lot of work we did. We looked at, Shaun, lots of studies, pathogenesis, lab studies, and then interventions. So soon you would see that to be present on React 19. And quick plug for React 19. If you like the work they're doing and they're serving the community, you should donate and support them. Brad has a question. Does anyone know anything about Efrin's study on GLP-1s for MCAS? And does anyone know anything about the research around microRNA and its impacting mast cells? So I have had Dr. Afrin on my channel once or twice, I believe. However, I'm not aware of his GLP-1 studies. I have heard about it, that the GLP-1 is able to reduce mast cell activation. I was actually a few days ago looking at the mechanisms for how does that do. So I'll do a lecture about it.
I would just add I tried GLP-1.
And how did that go?
Terrible. I ended up in an emergency room.
Oh, wow.
Yeah, 2 doses of the lowest dose of tirzepatide, and it shut down my entire GI system.
Sorry to hear that.
I know, and I tried it for anti-inflammatory effects, and I believe, and I'm not saying that anything I say, let me caution, doesn't mean that it's applicable to you.
Yeah.
This is what happened to me. And I think that's one thing I want all the injured to know. When you listen to these stories, like all the stories were all just anecdotes, right? What's good for me isn't necessarily good for you. But yeah, and I read subsequently a lot of articles about it and the risks of GLP-1 in people with autonomic and dysautonomia, because GLP-1 receptors are everywhere in the body. So
Thank you for this comment. John says, and this is actually interesting for me as well. Isn't it amazing there is no spike protein level test readily available in any case? And, my quick one sentence, John, sometimes I wish I had enough funds to actually create this test, because this is a very important test. Shaun?
I mean, again, I went around because when I was away from in my recovery phase and offline, I still was engaged, right? I was engaged in the research, but I limited and compartmentalized my time. And I looked at this testing of spike protein, and and that all stemmed from that Yale study, right? With the hypothesis that it could be still circulating, but in all the investigations of all the testing out there, it's all very research based, and still I don't think there's a very highly accurate assay that can differentiate whatever the spike protein they're seeing is vaccine or viral. It's very difficult. And as you know from other studies that are published, now they're saying that spike protein can be found circulating in the blood for up to a year, even in just viral people. So, and what it means or doesn't mean, I mean, there's so many unknowns, right? But we hear a buzzword like microclots or iliac vein compression or spike persistence, and then it becomes like gospel overnight. But yet the body of research and evidence isn't there to support anything. So, I mean, I don't even know if you test in the plasma, is that useful? Is it somewhere, if there is this theory, is it in the linings of gastric epithelium or where there's a high concentration of immune cells? Is it in other tissues? Like, there's so much work that needs to be done to really understand it.
Yeah, I think even before all of that work, there has to be a mindset change in mainstream medicine to say this happens so that they can start doing the research. So far, I believe there is not even an acknowledgement, even not still. Brandy says, have you heard of Cunningham panel? I have not either, Brandy. That is the first time coming across. Sorry for my lack of knowledge too. Eva says, is there a theory to explain why all symptoms go into remission for months there, out of nowhere they flare up?
That is classic autoimmune diseases, right?
Correct.
Flares,
so
anything can trigger, and then they go back into remission. You can talk about that, Dr. Bean.
Yeah, just very quickly, autoimmune diseases have this behavior where the immune system cells become activated because of something that bothered them. And now they are active and they are producing antibodies, or they are cytotoxic cell going and killing other cells, or there are innate cell activated and doing things. And then they ramp down. They ramp down because there are controlling systems, for example, T helper 17 or T helper controllers or regulatory T cells, whose job is to then dampen the immune system, to say, okay, enough, now you stop. So when that controlling system kicks in, it would reduce the output of the immune system and you would start feeling better. Then comes another event. Somebody ate fried food, or somebody ate food with histamine, or lots of carbohydrates, or stressful event. I took a plane ride and my glucose levels went up. Whatever, or a viral infection, or a surgery, or a medical procedure. And that causes once again a flare up, and that flare up once again takes a long tail to recover from. And it is sad for those where the flare ups persist for a long time because their immune system just is dysregulated, upset with the body as well, and just keeps attacking the body. And then whenever immune system would attack a cell in the body, the other immune cells and immune proteins will become activated as well, thinking there is a war going on. So it amplifies until it regulates again. And in some people, regulation isn't easy. Even the regulatory system is damaged. So you ramp up the response and then you don't bring it down in time. So Shelley says, why then does so many things affect us and give us flare-ups, but all of those other people took the vaccine? My brother had 6 of them and doesn't have anything happen. So isn't this the question for which we would all have been putting our funds and monies and mindset and intelligence to answer this question? That is a very important. What do you think, Shaun?
I think that's the $1 million question, right? But I do believe, I mean, if we look at the most logical explanation, right? We received a vaccine. The vaccine works on triggering your immune system, right? And this was very potent. And in some of us, it sparks such a high level reactogenicity that for some of us, our bodies just went haywire. And whether it was, whatever pathway it was, the complement pathway or interferon or T helper cell, follicular helper cells, or whatever, the whole cascade went into action, and errors can happen. And for me, that is the most logical. And then I think when I followed the NIH study and they found complement dysfunction in some of the subjects that went there, that just further enhanced my suspicions about some kind of autoimmunity or some kind of immune dysfunction. And I think today those theories keep coming back, right? Like people still now are talking about autoantibodies, about complement dysfunction, about our the lipid nanoparticle also triggering a reaction in the body. So anytime you do that, like it just makes logical sense to me, right? You give something that's going to ramp up the immune system makes an error, and you get an autoimmune disease. I mean,
agreed. And
logical. I can't say that for fact because we don't have the research, but in my mind and the way I felt what was happening in my body and the cascade of symptoms, it seemed logical to me, right? Like it wasn't like, not to dismiss any other theories, but it wasn't like I had suddenly mold toxicity on day 1 of my vaccine, or Lyme disease, or some other, it was clear like what was happening in real time over days. It was like a reaction to something that was put into my body, and that reaction is the immune system ramping up, right? So I'm going to comment on this question as well, and then there is one more question, and then we'll break. I know that, Shaun, we've been up for 1 hour, 17 minutes, with some breaks in the middle, unintended. So, Shelley, one more thing. There is a very interesting study from Yale and React-19. I think it is Akiko Awasaki's study, which showed that a difference in those who became injured by vaccine versus those who were not. They found, and I actually wrote a Substack about it. I did a lecture about it as well. It is fascinating. There are some studies that stick in my head because I believe there is a core message there, and then the whole community just ignores it. What that team showed was those who are vaccine healthy, who had the vaccine and nothing happened, their immune systems actually reduced its activity
because there were some parts of the immune system whose activity was enhanced by vaccine continually. And so the remaining system brought itself down to compensate and went back to baseline. And in the vaccine injured patients, the immune system, when it was ramped up by the vaccine, the compensatory counterbalancing downward was not happening, and those interleukins stayed high as well. So now you have a higher inflammatory response with vaccines upregulation of certain parts, and those patients actually had symptoms. So to me, from that study, my conclusion, not their conclusion, my conclusion is these vaccines, especially COVID mRNA type vaccines, can modulate the immune system for a long time, and the remaining immune system has to counterbalance itself. And if it doesn't, you got injury.
Right, and not only for a long time, but at a high degree, right?
Correct.
It's a very intense mRNA, because it's not like you're getting a normal antigen, right? Like your body's doing more work. You're making the antigen for number one, so there's room for error there, and then your body has to respond to whatever is being produced.
Yep. And then,
but also, Dr. Bean, if you take a step back and you look at the macro view, because a lot of times when we're in these discussions, we really talk about this one phenotype of a syndrome, right? More neurological POTS, neuropathy. But if you look back at this spectrum, like there's people, if you look at the case studies of things that have occurred after the vaccines, like people had eczema, full body eczema out of nowhere who've never had eczema before. Or, in myocarditis, that's also inflammatory, right? It's whatever vulnerabilities were in people. Also, things got tagged, right? Some people had clear transverse myelitis. Some people had GBS. Some people had whatever, right? So it's a bigger spectrum of things. Then, if you also take a bigger look at the very limited body of research in vaccine adverse events through history, you'll also see like there are case reports of people who got small fiber neuropathy after HPV vaccine or dysautonomia, right? It's not the first time it happened, but because this was rolled out on such a mass scale, all at once you see an eruption of a lot of really catastrophic things.
correct.
So I mean, that's how my mind wraps around it a bit to try to understand what's happening. But I think sometimes people just get very buried in one pigeonhole, right? And they're not thinking about the bigger picture and taking a step back.
Understood. Yep. And so one last question, and our discussion, Shaun, almost makes me request you that we should have more discussions, more focused on various parts of the journey, your journey and the solution sets. For example, I'm thinking of this study from Berkeley, UK, where they showed that the ribosomes, they slip on the mRNA vaccines, causing off-target protein production, which can then potentially cause autoimmune outcomes. And so that is a pathology that is fascinating to look at, to say, oh my God, we should make sure that this does not happen. And the researchers also had a solution given for that as well. I do not know if that is incorporated or not. So one last question. So Eva says, so if remissions happen more often, does it mean possible recovery?
Cannot answer that question, right? Because it's
Yes.
It seems like a novel illness, so we don't really know. I think it gives hope. I think remissions always give hope, right? And the longer remissions last, it gives more hope. But I think I was going to end on like where I am now and where I'm going, and I think that that's an important thing for people to realize. Like, I don't want to give anybody the impression that my life is amazing and it's complete and I'm cured. That's not the case. But am I, with treatments, am I in a better place? Yes. Is my mind in a better place? Yes. Am I able to better navigate my illness because my mental health is in a better place? Yes. Do I still have days where my ringing is so bad that if I stopped for a minute, I'd go in a closet and cry? Of course I do. But I'm better at handling it. And one of the biggest things that helped me mentally was getting back to work part-time and seeing patients again. and removing the focus from myself and back on to other people who are sick. And that has helped me tremendously. That was something I wanted so badly because I felt like it was ripped from me. And all those things that were taken from our lives. And for that one, because medicine was a second career for me, I wanted that back so desperately. And I worked so hard for that degree. And just to be able to see patients again and focus myself on caring for them has been so good for my heart, my mind, and my soul.
Understood. So with this, Shaun, thank you so much. I know that you just moved. I know you're setting up, and you still gave us time as well. Thank you very much for joining in. Thank you very much for your questions. And my commentary, my last few words, I still think that after 4 or 5 years, 6 years of this illness, we are still standing at, from a decision-making point of view, we're still standing at the same place. There may be lots of research. We're just still in denial. By we, again, I don't mean myself. I mean those who hold the decision-making.
Can you give me 2 minutes?
Yes, please.
I just wanted to say thank you to you for never giving up on us, for being there from the very beginning. It isn't easy. All speaking out isn't easy. We face a lot of backlash, but you stayed with us. You stayed on the topic. You didn't give up. And thank you to React 19 for their support of the injured. It goes without saying how valuable that is because no one has helped us. So they're there and they've helped us, and people should support their efforts.
Absolutely. So thank you very much, Shaun. I'm glad I'm there, and I'm still similarly determined to continue to help and figure out solutions, and also dispel so much myth that is out there, which is causing people to try this and try that, and there clearly is no connection, but people are just, they're trying to feel healthy. So with this, thank you very much, Shaun. Thank you, audience, for your presence here. And Shaun, I would reach out to you again, and I think we should talk a little more.
Yeah, it would be great.
Awesome.
Good seeing you again. Thank you.
Bye-bye, everyone.